Many teenagers develop pain below the kneecap during sports. Some recover quickly. Others continue having pain for months despite rest, treatment, and reduced activity. Why does this happen? Why do some adolescent sports injuries become persistent and difficult to resolve? In this Neuro Clinical Case review, we explore one adolescent tibial tuberosity pain case and discuss how broader clinical reasoning may change the treatment direction. Many teenagers develop pain below the kneecap during sports activities. This is especially common in adolescents involved in running, jumping, football, basketball, martial arts, athletics, or other repetitive lower limb activities. Most patients are told the problem is tendon strain, overuse injury, growing pain, patellar tendon inflammation, or Osgood-Schlatter disease. In many clinics, treatment mainly focuses on local tissue irritation around the patellar tendon or tibial tuberosity region. For some patients, this approach may work reasonably well. Symptoms may improve temporarily with rest, stretching, massage, physiotherapy, taping, braces, or anti-inflammatory treatment. However, not all patients improve easily. Some adolescents continue having pain for months, others improve temporarily, but symptoms repeatedly return after sports activity resumes. Over time, running, jumping, squatting, stairs, or training may continue triggering pain around the tibial tuberosity region. This creates frustration not only for the patient and family but also for clinicians. Why does the pain continue despite treatment? Why does rest sometimes help only temporarily? And why do some chronic adolescent knee pain cases become persistent and recurrent? These questions are clinically important because in some cases the problem may gradually become more than simply a local strain. Knee pain below the patella may not be a simple strain. Many teenagers develop pain below the kneecap during sports activities. This is a very common presentation in clinical practice, especially in active adolescents involved in running, jumping, football, basketball, martial arts, athletics, or school sports. Most patients are told this is tendon strain, overuse injury, growing pain, or patellar tendon inflammation. In many situations, this explanation may be partly correct, especially during the early stage of symptoms. Some patients improve after temporary rest, stretching, physiotherapy, massage, taping, braces, or anti-inflammatory treatment. However, not all patients improve easily. Some teenagers continue having pain for months. Some improve temporarily, but the symptoms repeatedly return once sports activity increases again. Over time, both the patient and family may become frustrated and confused. Why does the pain continue despite treatment? Why does rest sometimes help only temporarily? Why do some chronic adolescent knee pain cases become persistent and difficult to resolve? These are important clinical questions. In this Neuro Clinical Case review, we explore one adolescent tibial tuberosity pain case and discuss why some chronic cases may involve more than simply local tissue irritation. More importantly, this case demonstrates how broader clinical reasoning may change the treatment direction in persistent adolescent sports pain cases. The patient in this case was a teenage boy with persistent pain below the kneecap. The pain was mainly located around the tibial tuberosity region, just below the patella. His symptoms became worse during running, jumping, squatting, sports activity, and climbing stairs. He especially noticed increased pain after repetitive lower limb loading during physical activity. At the beginning, the problem was believed to be a relatively common sports-related knee strain. His family initially thought the symptoms would gradually improve with time and rest. Different local treatments had already been attempted, including activity reduction and conservative management approaches. At times, the symptoms appeared slightly better, but the pain repeatedly returned once sports activity increased again. Over time, the patient became increasingly cautious during movement. Certain activities began triggering anticipatory tension and protective behavior around the knee region. This is a very common clinical situation in adolescent sports-related pain conditions. Many young athletes improve temporarily, but later relapse again once loading increases. The important clinical question is not only where the pain is located, but also why the pain pattern continues returning. In many chronic adolescent knee pain cases, treatment focuses mainly on local tissue findings. Clinicians often focus on patellar tendon irritation, traction stress, inflammation, local swelling, or mechanical overload around the tibial tuberosity region. In some situations, this approach may be appropriate, especially during the early inflammatory stage. However, in persistent cases, local tissue thinking alone may not fully explain the ongoing symptoms. Some patients continue having pain despite rest, stretching, physiotherapy, massage, braces, taping, or temporary reduction in sports activity. Others improve temporarily, but the symptoms repeatedly return once physical loading increases again. This is where broader clinical reasoning becomes important. In some chronic adolescent sports injuries, the problem may gradually become more than simply local tissue irritation. Repeated pain experiences may begin influencing movement behavior, muscle tension, protective loading patterns, and nervous system sensitivity. Over time, the body may continue protecting the painful region even during relatively normal activity. This changes the overall clinical perspective. Instead of asking only where the pain is, we may also need to ask what is maintaining the pain pattern. During assessment, several important clinical findings became noticeable. The patient showed significant lower limb tension, particularly through the quadriceps pattern. There was also altered movement control and protective loading behavior during functional activity. Pain sensitivity around the tibial tuberosity region was clearly present, especially during activities involving repeated loading through the knee extensor mechanism. However, the most important observation was not simply local tenderness. The overall pain behavior appeared more consistent with a chronic tension protection pattern rather than a simple acute strain. Over time, the patient had gradually developed protective movement strategies around the painful area. Certain movements triggered anticipatory guarding and increased muscular tension even before strong loading occurred. This is clinically important. In some chronic adolescent sports pain cases, persistent symptoms may involve not only local tissue irritation, but also broader neuro-functional adaptation within the movement system. This observation significantly changed the overall clinical reasoning and treatment direction in this case. This is the key neuro-functional discussion point in this case. In many persistent sports injuries, clinicians naturally focus on the location of pain. However, in chronic cases, it may also be important to ask what is continuing to maintain the pain pattern. Several factors appeared clinically relevant in this patient, including persistent muscle tension, repeated traction stress, altered movement behavior, and protective loading patterns around the knee region. Over time, repeated pain experiences may increase nervous system sensitivity. The body gradually learns to protect the painful area, and this protective response may continue even during relatively normal movement or activity. As a result, some teenagers continue having symptoms despite long periods of rest. This is an important clinical observation. Rest alone may reduce temporary irritation, but it may not fully reset the chronic tension protection pattern that has already developed around the movement system. In some persistent adolescent sports pain cases, the nervous system, movement behavior, and muscular protection patterns may all contribute to ongoing symptoms. Many patients and parents believe that if a teenager rests long enough, the pain should completely disappear. However, in clinical practice, this is not always what happens. Some young athletes rest for weeks or even months, yet the symptoms continue returning once sports activity resumes. Others become trapped in a repeated cycle of temporary improvement followed by relapse. Why? Because persistent pain is not always maintained only by tissue injury. Over time, chronic tension patterns, protective movement behavior, altered loading strategies, and nervous system sensitization may continue maintaining the pain experience even after the original irritation has partially improved. This is why some adolescents become increasingly cautious during movement. Running, jumping, squatting, or sports participation may gradually trigger anticipatory guarding and protective muscular tension around the knee region. In some cases, the body continues protecting the area long after the initial injury phase. This helps explain why rest alone may sometimes provide only temporary relief rather than long-term resolution. The treatment approach in this case was not focused only on the painful point below the kneecap. Instead, the overall goal was to reduce excessive lower limb tension, decrease protective muscle guarding, improve movement tolerance, normalize loading behavior, and gradually reduce local sensitivity around the tibial tuberosity region. Local treatment was still important, but the clinical reasoning became broader than simply treating a local strain or tendon irritation. This is an important concept in persistent sports pain management. Sometimes ongoing symptoms are maintained not only by tissue irritation itself, but also by chronic tension patterns, altered movement behavior, protective loading strategies, and nervous system sensitization. As treatment progressed, the focus was not only reducing pain but also improving confidence during movement and gradually restoring more natural loading patterns during activity. In persistent adolescent sports pain cases, changing the movement protection pattern may be just as important as treating the painful area itself. As treatment progressed, the patient gradually reported less pain during sports activity and improved tolerance to movement. Running, jumping, squatting, and stairs became easier compared with the earlier stage of the condition. Sensitivity around the tibial tuberosity region also gradually reduced. More importantly, the patient became less fearful and less protective during movement. This is clinically significant. The improvement did not appear to occur simply because of prolonged rest alone. Instead, progress became more noticeable when the overall tension protection pattern around the knee and lower limb system began changing. In chronic adolescent sports pain cases, restoring confidence in movement may be an important part of recovery. When excessive protection gradually decreases, the body may begin tolerating normal loading more naturally again. This represents an important clinical distinction between temporary symptom suppression and broader functional improvement. Many chronic adolescent knee pain cases fail because treatment focuses only on local inflammation, tendon irritation, or temporary symptom reduction. However, persistent sports pain is often more complex, especially when symptoms continue for months or repeatedly return after activity resumes. In some cases, clinicians may successfully reduce local irritation temporarily, yet the broader movement protection pattern remains unchanged. As a result, the body continues responding to loading with excessive guarding, altered movement behavior, and recurrent pain sensitivity. This is why some young athletes improve temporarily but relapse repeatedly once training intensity increases again. The important clinical question may not simply be whether the tendon remains inflamed. Instead, we may also need to ask why the body continues protecting the area and what factors are maintaining the persistent pain pattern. This is where broader neuro-functional reasoning may become valuable in difficult adolescent sports pain cases. Knee pain below the patella is not always just a simple local strain. In persistent or recurrent adolescent sports pain cases, clinicians may need to consider broader contributing factors beyond local tissue irritation alone. These may include chronic tension patterns, altered movement control, protective loading behavior, nervous system sensitization, and repeated pain-related guarding around the lower limb system. Over time, these factors may continue maintaining symptoms even when the original tissue irritation has partially improved. This does not mean local pathology is unimportant. Rather, it highlights the importance of broader clinical reasoning in difficult chronic cases. Sometimes changing the clinical reasoning changes the treatment direction, and changing the treatment direction changes the clinical outcome. Persistent pain is not always explained completely by local tissue findings alone. In some chronic adolescent sports injuries, understanding tension patterns, protective movement behavior, altered loading strategies, nervous system sensitization, and broader neurofunctional relationships may help clinicians rethink difficult cases. This case review is not intended to replace standard medical diagnosis or conventional treatment approaches. Instead, it aims to encourage broader clinical reasoning when managing persistent or recurrent adolescent sports pain conditions. Sometimes the most important clinical question is not only where the pain is located, but also what is continuing to maintain the pain pattern. Thank you for watching this Neuro Clinical Case review, produced by Dr. Huang Neuro Acupuncture Clinical System. For more clinical case reviews, neurofunctional reasoning discussions, and future CPD learning content, please subscribe to the channel. Certificate download and future CPD access may become available in future releases.